Prior to starting OCREVUS, as it is with any medication, it is important to be aware of its side effects. First on the list is cancer. In the studies that were done, OCREVUS was compared with Rebif. Of the 781 people who were treated with OCREVUS, there were a total of 6 cases of breast cancer, while there were no cases of breast cancer reported in the 668 people who were taking Rebif. All of the people in the study who got breast cancer were women. It should be noted that less than 1% of all breast cancers in the general population occur in men, but since it is possible for men to develop breast cancer, everyone should understand the potential risk. The manufacturers recommend that patients should follow standard breast cancer screening guidelines while on OCREVUS. Aside from breast cancer, several other cancers occurred. These other types of cancers were seen in both the OCREVUS and the Rebif groups. In the patients treated with OCREVUS, there was 1 case of renal cell carcinoma and 1 case of malignant melanoma. In the patients treated with Rebif, there was a case of lymphoma and 1 case of squamous cell carcinoma. The next side effect of OCREVUS is its infusion reactions. The medication is given intravenously once every 6 months. Infusion-related reactions occurred in 30 to 40% of the patients in the ocrelizumab group. The patients in the Rebif group were given placebo infusions. In that group, 7.3% of the patients had infusion reactions. Most infusion-related reactions were mild to moderate, such as flushing and itchiness, and were reported at the first infusion. The reactions were managed by slowing down the infusion rate and by treating the person's symptoms. One patient in the ocrelizumab group had a life-threatening episode of bronchospasm, which causes trouble with breathing. It occurred during the first infusion. The patient declined hospitalization and recovered with treatment at the infusion site. The most frequent symptoms of infusion-related reactions with ocrelizumab included itchiness, rash, throat irritation, and flushing. To mitigate the infusion reactions, each person who gets OCREVUS is pre-medicated with 100 milligrams of methylprednisolone, which is a steroid, given intravenously. Tylenol and an antihistamine like Benadryl are also given. Additionally, to help lessen the infusion reactions, the dose of OCREVUS is split in half for the first infusion. This means that the first time a person gets OCREVUS, he or she will get 300 milligrams IV at the first infusion. 2 weeks later, they will get the other 300 milligrams of the medication for a total dose of 600 milligrams. This is only done for the first infusion since the majority of infusion reactions happen at the first infusion. All remaining doses of OCREVUS are done at 6-month intervals. The most common infections were upper respiratory tract infections. 58% of patients who got OCREVUS had infections, while 52% of people in the Rebif group got infections. In addition to the upper respiratory tract infections, patients also got lower respiratory tract infections, skin infections, and herpes-related infections. The herpes-related infections included herpes zoster, herpes simplex, oral herpes, and genital herpes. If a person had an infection, the next infusion was postponed until the infection resolved. Here are some other things that we need to be aware of. Hepatitis B. Of note is that if you have a history of hepatitis B, you shouldn't get OCREVUS. There were no cases of reactivation of hepatitis B in the OCREVUS studies. However, in other medications that work like OCREVUS, cases of liver failure and death have occurred. This is because these medications reactivated dormant hepatitis B. Because of this, all patients will need to get blood work done to screen for hepatitis B before starting OCREVUS. Pregnancy. OCREVUS has never been tested in women who are pregnant. Because animal studies have shown fetal harm, men and women who are sexually active need to use an effective form of contraception while on OCREVUS, as well as the 6 months after the last dose of OCREVUS. Lactation. There have been no studies showing that it is safe to breastfeed while being on OCREVUS. We know that OCREVUS is excreted in the milk of monkeys who were treated with OCREVUS. Because of this, anyone who wants to breastfeed while on OCREVUS needs to discuss the risks with their doctors. OCREVUS has not been tested in pediatric patients, so it is not known if OCREVUS is safe to use in children. Also, there weren't enough people who were over the age of 65 in the studies that were done to statistically determine if OCREVUS was safe for people over the age of 65. Vaccinations. If you get a vaccination, you must wait 6 weeks before taking a dose of OCREVUS. Also, you cannot get a vaccination for 6 months after taking OCREVUS. PML. There were no cases of PML in people who took OCREVUS in the studies. However, there have been cases of PML in other medications that work like OCREVUS, so we need to be aware that PML might possibly show up. Well, I hope you like this overview of OCREVUS. I think it has a good chance to help out a lot of people. Before we end, though, there are some other things I would like to mention. Disease-modifying therapies are an incredibly important part in helping slow down the course of our disease. And like all good MS doctors, I work with my patients to make sure that they are on the best therapy that is right for them. But there is something else that I have come to learn over the years. Great doctors aren't always the ones who run MS centers or are part of the largest MS doctor group. The greatest doctors are the ones who realize that since they don't have MS, there are some things that they are never going to be able to understand about having MS. I believe that these self-aware doctors are the greatest MS doctors because they can understand that they can't understand. They listen to and learn from their patients. The care of a person suffers when there isn't time for a doctor to be able to listen to their patient. Quite often, how long a doctor can spend with a patient is determined by the bean counters. To borrow a phrase from a great comedian, homie, don't play like that. I've been in private practice for about 15 years after having worked both in group practice and in the hospital setting. I didn't like having 25 minutes to see a new patient or 15 minutes for a follow-up. That's not enough time to get to know the person who has come to me for help with their medical problem. The vast majority of my patients are MSers. They like knowing that I take as long with each person as is needed, and they know if I'm running behind in my schedule, it's because I'm taking time listening to the patient who I'm with, just like I did for them. The monetary payment I get for an office visit might not be so great, but the reward I get from trying to help improve someone's life is far greater than whatever material things money can buy. Don't get me wrong, money is a great thing to have. You can do things like buy food, pay a mortgage, or get a new shirt because your wife says that there are way too many ketchup stains on my favorite shirt that I've had since I was in college, and that friends and family are starting to complain. That's why I try to make my money writing. I mentioned in my book Multiple Sclerosis from Both Sides of the Desk. I wrote it not only to teach about what MS is, but also to try and help people without MS understand that they can't understand. But I don't do it by telling people what to do. I do it by showing them, using creative writing pieces, the absurd world of MS from the inside out. The nice thing is that since I'm a doctor, I can teach about the medical things that can be done to make our lives a little less absurd. Plus, since I'm a comedicaledian, I make sure to make it funny. Not only because I love the sound of laughter, but also because it makes people feel good inside without using any medication. That's why I call myself a comedicaledian. Comedy, medicine, all in one. So if you're looking for an MS neurologist or would like to make an appointment with me, you can call my office. My office, which I share with my wife, who's a breastfeeding medicine physician, is located at 1575 Hillside Avenue, New Hyde Park, New York, 11040. The phone number is 516-498-2300. Our website is macalusomedical.com. Well, I hope you enjoyed the program. I will probably be making more shows as more drugs come out. But the thing I want you to remember is the laughter. Because laughter truly is the best medicine. Unless you're bleeding internally, of course. Then you should go to the emergency room. Thank you. Good night.